Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. On today's episode, we're speaking with Marc Gregory Knowles, the CEO at Ollie Health. And since he said this, no, this is no relation to Beyonce, but if you want to think it and that makes you listen to the podcast, please listen. Marc, how are you?
Hey, Jared, thank you so much for having me on. Unfortunately, not the second cousin to Beyonce, but I'll take the credit anyway.
I think the listeners will get over that disappointment once they get to hear what you're working on. So
let's hope so. Let's hope so.
Well, I'm really excited to have you on the podcast. You and I met probably a couple weeks back. You were one of the reasons I realized that, for the audience to know, I'm sure you're going to break it down, but you're over in South Africa. And that was when I started realizing that anyone was listening to the podcast over in South Africa. So thank you. Thank you for listening. I really love if you could kick things off by telling the audience a little bit about your background, and then we'll talk about your company, Ollie Health.
Yeah, amazing. Thanks for having me on. It's a privilege to have me from South Africa. I'm sure not many of your listeners will have a background or understanding of the tech startup scene here or health tech. My background, I grew up in Pretoria, South Africa, actually going to a similar high school as Elon Musk, which I'm sure your listeners know a little bit about. But I ended up going to university and working with a couple of tech startups, and was lucky enough to make my way over to Toronto, Canada. And I was working at a place called the Dev Hub there, which is this kind of hybrid startup accelerator, which was a massive experience and change for me. I was 24, 25, heading over to this completely different world. It was like the depths of winter, like -20. And here's this kid from South Africa. It was like this huge shock. But it was an amazing, amazing experience. And one of the key insights that I kind of learned when I was there was just the amount of tech and the energy behind tech, especially going into healthcare. I saw one of Andrew Wilkinson's investments, which it was such a simple web platform that allowed you to just see the waiting time at different clinics, which to me was a completely foreign concept coming from South Africa. And when I returned to South Africa, kind of just before the pandemic, I was hugely inspired to bring some of that tech to healthcare in South Africa, which is what we're doing now with Ollie Health.
Thank you for that intro. Yeah, it's is that like a common path? Because I know when Musk left South Africa, he went to Canada for a bit, I believe. Didn't he?
He did, yeah. I think he went to Ottawa. Or
yeah, he went before. I think before going to college, he went there. I think with his mother or something like that. Big fan of the book, which there's not many books obviously that detail his life and kind of what he went through. But the book Elon Musk is probably one of my favorite books.
It's probably one of mine as well. Actually, I read it just coming out of high school, I think it was. I was in first year uni, and a big reason why we kind of started our first company actually.
He's probably he's got to be a hero over in South Africa, is he, or no?
Yeah, I think he is. He's kind of, it depends. I guess if you like the everyday South African, maybe they don't really realize exactly what he's doing over in America. But if you work in tech, it's just his capacity to take risks. I mean, where he came from and what he sacrificed and still sacrifices now is just unparalleled. So I think that's kind of for me what's so inspirational about Elon.
Yeah, absolutely. Well, I want to talk more about, we could probably talk about Elon. You could do a separate episode about talking about what we like about him all day, right?
Yeah.
I want to shift focus into Ollie Health, right? Your company, Ollie Health. Can you give us a little bit of a background? I focus on three things. Give us why you started it, how it works, and really what you're doing with it.
Yeah, I think essentially what we're trying to do with Ollie Health is create Africa's first healthcare currency, making healthcare more accessible and affordable. I think it might be useful for me to kind of give an overview of what the healthcare landscape is like, especially in South Africa. Fewer than 1 in 5 South Africans actually have access to medical aid, which essentially means 80% of the population don't have access to private practitioners. They're going to public and government sector clinics, which are often super overloaded, and the access to healthcare is just extremely limited. But at the same time, there's this mobile boom that's taking place where there's more mobile SIM cards than there are people in South Africa. It's just absolutely exploding. But access to healthcare is just extremely limited. These medical aids, which are, I guess, our equivalent of medical insurance, they essentially control the entire healthcare industry, right? So everything from the pricing and access to practitioners, it comes through these medical aids. But these schemes were designed 20 years ago when employment was a little bit more stable, and they were supplying these medical aid schemes for employers. But now, as family budgets shrink, more and more South Africans are having to pay upfront cash to go see practitioners. In some instances, taking an hour taxi, which means missing the entire day of work. It's the cost of transport for students. And that's just a massive barrier. And ultimately, it's leading to a large population of South Africans not getting, the healthcare services that they require. So our concept is we have a small monthly fee to become a member, which give you access to all of these tokens. And these tokens you can use to redeem a 20-minute telehealth session, at-home COVID testing. And you can even redeem for an in-person visit as well if you want to go to a women's health or a men's health clinic. And the real kind of inspiration behind it is we want to have a small fee that makes these healthcare services more accessible without a patient ever having to worry about, do I have to pay upfront cash? Is my medical insurance going to claim and pay for this service? You're never having to worry about that. Any booking made through Ollie Health is fully redeemed by your monthly tokens.
Do these monthly tokens, and also, I think you might have mentioned it, but I'll also mention it. You're not talking blockchain, right? Whenever we hear tokens, that whole term has been changed by the blockchain technology and cryptocurrencies, right? What we talk about it. You're talking about tokens that you purchase, right? And then you're able to redeem for care.
Absolutely. So it's not on the blockchain. It's not a decentralized system. It's essentially, we're trying to solve this, what we believe to be this meta problem with telehealth. Is it a temporary solution to a temporary pandemic, or can it be the future of how we actually deliver healthcare? We believe it absolutely can, and it has to, especially for populations in more rural areas that we have in South Africa. But the problem is the transaction value. What is that experience like for the patient? Do they have access to these providers? Can they easily book instantly? And how much is this telehealth session going to cost? And if we own that entire journey and we make it as simple as possible by saying, pay a small monthly fee, you get access to your tokens, and you will always know that you have access to a therapist or a general practitioner or at-home testing when you need it.
And do these tokens, do they expire on a monthly basis? Do you have to use them every month?
So you don't have to use them. We have a 3, 6, and 12-month plan. If you purchase a 3-month or 6-month plan, then you get all of your tokens up front. So if you do need at-home testing, or you want to have a continuous session with a mental health practitioner, you can use them. But your tokens will expire essentially when your membership expires with Ollie.
Thank you for sharing. Yeah, that's a super interesting structure. Different structure than what I usually hear, but I can see how it works. What are some of the things that you're really excited about in terms of Ollie Health moving forward, right? We're halfway through 2021. What's next for the company?
Well, we've just closed our seed round of investment, which for anyone, being 26 and in South Africa with a big vision in an industry that, we haven't studied medicine, myself and my co-founder, we come from a tech background. And, raising capital in the climate in Africa is completely different than Toronto or Miami or New York or Silicon Valley. access to capital here is extremely limited. And, we've had an extremely big vision to take telehealth to the mass public of South Africa. And, closing that seed round isn't just a vote of confidence. It's going to allow us to build the team to execute on that vision. And South Africa needs access to more affordable healthcare. And that's what we're going to do day in, day out to try and deliver that. And with these tokens and this currency, we're seeing that adoption with telehealth is going to become more centered around the patient experience. And we're incredibly excited to see what we can build over the next 5 to 10 years.
Yeah, that'll be interesting to see the continued progress. I know you and I are going to stay in touch, and hopefully we can do a podcast like this again soon. Kind of see where you're at, see what new problems you're addressing, or even are you running into any problems, and how have you decided to go about solving them? I think the audience really likes hearing those type of episodes. But I want to thank you so much for being a guest once again. Appreciate it.
Thank you so much for having me on, Jared. Really appreciate it.